So I found out I had cancer at the age of 32. It was right before the pandemic hit. And I also found out I was 6 weeks pregnant with my third child. So to say it was a shock was quite an understatement in my family's life. Receiving the chemotherapy and resulting hair loss was heartbreaking and devastating to me. I felt like that was the true signal that I was a cancer patient.
First thing is, I'm gonna be honest, am I gonna lose my hair? That's the first thing. It sounds vain, but it's reality. It's like, oh, I'm gonna lose my hair. It's like, I didn't think of chemo is going to happen, how is it going to affect my body. It's like the first thing is people will know.
It's not just about vanity. It sometimes can be who we are, right? So the first thing you think about, because there's always someone that we know who's had cancer. We know that you lose hair because of it. So when I first heard the diagnosis, I was like, okay, outside of please don't let me die, right? And then going through all of the stages, because you're pretty much on autopilot, right? As you know. And so then when your oncologist says, hey, there may be a solution where you don't lose your hair, you feel like there's somewhat of a lifeline.
It sounds kind of superficial to worry about about losing my hair right now when I have such bigger fish to fry. And it seemed like so much effort to figure out how we were going to do it, get it all set up and prepare to learn how to cap. And it was really our family friend who forced us pretty much into doing it. And I am so grateful that she did, because I couldn't have been more wrong. It is the furthest thing from being a superficial matter. It was such a game changer for me.
I am a 2-time breast cancer survivor. I was 30 years old, just married, just bought a brand new house, was finishing up my teaching degree, student teaching, and they told me that might not be able to have children after that. So it was a lot at 30 years old. I was very sick when I went through it, lost all of my hair when I went through it. And then, but I survived and moved on, and then 17 years later, I was diagnosed with my second bout of breast cancer. But this time, I did have 2 little girls. I was coming off of a divorce. I was starting from scratch. When I was told I was going to have chemo again, I flashbacks back to my first bout of it. I was so sick and lost all my hair, I decided that no, I was not going to do chemotherapy. I was very adamant. My nurse sat down with me after the doctor left, and she just said, hey, I just want to tell you this. I've heard really good things about cold capping. And I was like, well, let me see what this is all about. So I Googled it and I read a lot, thought about it, and talked to my oncologist. This oncologist was like, I can cure all of that. I can't cure your hair, but if this cold capping is available and you're willing to try it, maybe this could change your mind. So I did some soul searching and really thought about the cold capping, and I have to say that that's what made my decision to do chemo for the second time. I gave it a try.
As you have just heard, hair loss during chemotherapy can be a very difficult side effect for many patients. But with scalp cooling therapy, there is now a way to try to save your hair during chemotherapy. We understand that using scalp cooling is a very personal decision, but we want to make sure that our patients know all of the options. We have seen scalp cooling make a big difference for many, many patients. We are so glad that you are taking the time to see if scalp cooling is right for you. But remember that this process is time sensitive. You have to start it before your first chemotherapy treatment. Scalp cooling therapy, also known as cold cap therapy, is a way to try to save your hair during chemotherapy. It consists of wearing a cold cap that you place on your head hours before, during, and after the chemotherapy infusion. There are 2 main types of scalp cooling. There's the manual and the machine scalp cooling therapy. Regardless of the type, scalp cooling works in two main ways. One, the cold temperature limits blood flow to the scalp, thus reducing the amount of chemotherapy that actually reaches your hair. And two, the cold slows down the activity of the hair so that they don't take in the chemotherapy drug. I tell patients it's like putting the hair to sleep. Many people do not know that scalp cooling exists, but it has actually been around for decades. It has become much more popular recently because of research that showed that it can help and that it's safe. Manual caps are placed on a patient's head by a capper who can be a family member, a friend, or a hired professional. And the caps are placed on the head both before, during, and after the chemotherapy, just on the chemotherapy day when you get the infusion. The total time depends on how long your chemotherapy is and your specific chemotherapy type. The caps are changed every 20 to 25 minutes during this period. Caps are not used again on any day other than the day that you get your chemotherapy. For our patients at Henry Ford, you will have to bring a cooler with the caps in it that will keep it at the right temperature. Manual caps are not provided by the hospital. They are available for private rental. There are different brands, none of which are affiliated with Henry Ford Health. In your packet, there's a list of cold cap providers who you can call to arrange capping. Machine scalp cooling systems consist of a cap that is hooked up to a machine, which you wear about 30 to 45 minutes before the chemotherapy infusion, during, and then about 90 minutes after the chemotherapy infusion. These caps don't have to be changed like the manual caps because the machine moves a coolant throughout the cap to keep it at the appropriate temperature. Machine capping systems are leased by hospitals and clinics, and they're only available where they are installed. At Henry Ford Health, we do have Paxman machines at certain locations. For more information, look at the handout in your cancer packet for specific locations or reach out to your nurse navigator or social worker. You can only do machine capping at these centers. It is important to know that scalp cooling is not 100% effective, but it works well for many patients. Success is important to keep in mind, and we define it as keeping more than 50% of your hair, which is what you typically need to maintain in order to not have noticeable hair loss. More than half of patients that do scalp cooling have success, and many patients have higher success depending on specific factors. What seems to impact scalp cooling success the most are these factors. One is the chemotherapy regimen or the actual drugs that you're getting. Scalp cooling works better with specific drugs, and in a different section about what caps to choose based on your chemotherapy type, I'll go into more detail about that. If you have further questions about your chemotherapy drugs, talk to your doctor and nurse navigator to see what works best with your specific chemotherapy type. Second is the capping technique. It is very important that the cap is tight to the head and cold enough. I cannot overstate this enough. I always tell patients that you have to think about the 3 T's of capping: tightness, temperature, and timing. For manual caps, make sure that your capper, if it's a friend or a family member, is trained. You can talk to the cap companies about this. You can also hire a professional, but that is an additional cost. For both manual and machine caps, you just have to make sure that it's tight. We can see bald patches or specific areas of hair loss in areas where it's not tight or cold enough. Number 3 is hair care. There are guidelines that the cap companies will provide you. It's just very important that you're trying to minimize any trauma, tension on the hair, or any heat, really just trying to be as gentle as possible with the hair. Talk to the companies about their hair care recommendations and guidelines. Regarding scalp cooling safety, scalp cooling has not been shown to increase the spread of cancer to the scalp. In fact, in 2015 and 2017, machine scalp cooling systems were cleared by the FDA for solid tumor cancers. So some solid tumor cancers that are common are breast cancer, uterine cancer, testicular cancer. It also seems to be safe with some lymphoma cancers, particularly Hodgkin's lymphoma. Talk to your doctor about your cancer type and the safety of scalp cooling. The most common side effects for scalp cooling are things due to the cold. So headache, neck and shoulder discomfort, scalp pain, chills. If you have migraines, some patients say that it worsens their migraines. Some patients that I've talked to have also had frostbites. That's why it's recommended to protect your skin with padding around your hair and scalp area. These few side effects go away quickly when you stop scalp cooling. Please make sure to ask your doctor about pain control. Some patients have used things like IV Benadryl or anti-anxiety medications. Talk to them to see what plan you can make up to make sure that scalp cooling is comfortable for you, because the caps are cold, although patients tend to get used to it after a few times. The cost of scalp cooling varies depending on how long your chemotherapy treatment is, but on average, the cost is typically around $1,500 to $3,000 for the entire treatment. Please contact the manual cap companies for specific cost details, and if you're doing the machine systems here at Henry Ford, reach out to your social worker or your nurse navigator for the pricing. In your handout within the cancer packet, we give insurance codes so you can reach out to the insurance company to see if it's covered. There are also nonprofit organizations that exist both in Michigan and nationally to help cover the cost of scalp cooling. We acknowledge that scalp cooling is expensive, and we do not want costs to be a reason that you don't do the treatment. So reach out to your social worker or your nurse navigator if you're having problems with affording the treatment. Deciding to use scalp cooling can be a really difficult decision. Many of our patients who have had success with scalp cooling cite the following reasons for their decision to use it.
You know, we have been discriminated against by our hair. Our hair holds a history. It's so many layers to Black women in our hair. So when, you know, I was told chemo, that was one of the first things that I thought about was, oh my God, I'm gonna lose my hair. You know, it just like one more thing that you feel out of control within your own body during this process. You know, I was told by friends who love me, friends and family, like, well, why do you even care? You wear wigs anyway. We don't see your hair. And I'm like, but it's my hair. Like, it's still a part of me, my identity. Like, if I want to wear my own natural hair, I should be able to have the ability to do so, not because cancer took that away from me. And I truly felt that way.
I was 21 years old, and I didn't want everyone in my world to know I was sick. And I knew that when you lose your hair, and I'd heard from other patients, it's just that like scarlet A on your chest that I have cancer and everyone looks at you differently. And I really just wanted to be able to carry out my diagnosis and carry out my treatment the way I saw fit that was best for me, and be able to choose who I tell, when I tell, and how I tell, and have that autonomy for myself.
I don't want to be stereotyped, because, you know, if you don't have hair, right away people, you don't have to say anything, and right away they assume you have cancer, and they feel sorry, and they feel like, oh, you know, it's like that is one thing I didn't want to have. It's like, define me as who I am, not my diagnosis.
Every time that I pictured myself without hair, I worried about what my kids would think and how worried they would be. I worried about my patients that I was taking care of, if they felt that I was able to take care of them if I were ill. It was something where I felt like I wasn't going to look like myself. So I absolutely dreaded chemotherapy and the resultant hair loss more than anything. I asked about scalp cooling. I was aware of it through my profession in dermatology. There weren't a lot of resources at that time, and we felt my husband, who was my capper, and I felt we didn't know what we were doing. It gave us something to work on together, that it wasn't, when's the next surgery? how are you feeling? Is this gonna come back? Are you gonna die from this? Are the kids not gonna know their mom? Is my husband gonna be a single parent? It was just, let's work on this together. We can keep your hair. You can look more like yourself. You can feel like more like yourself. You can go out in public. You can go back to work. Nobody needed to know our story unless we wanted to share it.
So when the doctors tell you, hey, you're cured, if you want to call it, or in remission, and you can go on with your normal life, that's a very exciting feeling. Great, I'm healthy, let's keep going. But the next day you wake up and you look in the mirror and you have no hair. And you just look sick and you don't feel normal. And it takes a long time for hair to grow back and for you to feel like it's you. So I just felt like I didn't want to get up and look at that sickness every day. I also had 2 young kids, teenagers, that it's a game changer. I don't want them to look at me like mom's sick. And I knew I was going to have to go back to work. I took a whole school year off and I had to go back to work. And kids are used to seeing you a certain way, and I don't want them looking at me sick. So saving my hair, I just felt like would just encourage me to keep fighting and just to feel good about yourself. So if you feel good about yourself, you're strong enough to fight whatever's coming your way. So that's why I thought it was important to save my hair.
We all know that we like to have, as a people, like to have control over things. We know that getting older, we may gain weight or we may lose hair or we may not be as agile. We already know that that's part of the aging process. But then you have something totally different where it's cancer. And now you're saying, on top of that, I'm going to lose something else I don't have any control over. So when I was given the opportunity to have control over keeping my hair, it made the process of going through chemo even more bearable. I still felt feminine. I felt redemption, I guess is a good word, right? Like it didn't take me out. I didn't have to wear the wigs.
It is also important to recognize that some patients choose not to use scalp cooling. Some of the common reasons that patients don't use scalp cooling include people are worried about how well it will work. Scalp cooling is a lot of work, especially with the manual caps, because you have to bring a cooler with dry ice and you have to have a capper who will change your cap every 25 minutes. Cost of the caps, dry ice, potential wage losses for a capper, it's just very expensive to cold cap. The strict hair care, and some patients just aren't worried about hair loss. It can be hard to choose between manual cold caps and machine scalp cooling systems. Here is the way that I like to counsel patients because it is a very personal choice. The first question is, does my center offer machine scalp cooling? Only certain sites at Henry Ford have the machines. If not, then manual cold capping will be your only option. If you can go to one of the centers with machines, then you have to consider the following. Manual cold caps are more time consuming. You wear them for longer and you have to bring them in a cooler filled with dry ice. Manual cold caps also require a capper. This is a family member or a friend who is able and willing to learn how to cap. It is helpful to have 2 people who can come with you. It is quite simple once you learn, but it takes time up front to learn how to cap. The capper must be able to spend the whole chemotherapy day with you, as you are typically capping hours before, during, and after the chemotherapy infusion. You can hire a capper, however, that is additional cost each treatment. You can ask the cold cap companies about this option. On the other hand, machine caps require you to stay at the infusion center for the post-chemo capping, while manual caps allow you to cap at home afterward. The price is typically similar, however, machine systems can be less expensive depending on how long your chemotherapy is. Which one works better is typically the question that patients want answered in order to make the decision between manual and machine scalp cooling. Based on the available data, it appears that they are similar, but the chemotherapy type can make a big difference. It is a good idea to talk to your doctor about the type of chemotherapy you will get. I will talk about 2 categories of chemotherapy drugs and what types of caps seem to work best. Taxane-based chemotherapies are a type of chemotherapy. Check the screen for a list of chemotherapy drugs that fall into this category to see if you might be getting this type of chemotherapy. These chemotherapies have good success rates with both manual and machine caps. For anthracycline-based chemotherapies, which is another category of chemotherapy drugs, both manual and machine caps have lower success rates, since this type of chemotherapy is harsher on the hair. Some people have said that the manual caps work better for anthracycline chemotherapies because the cap companies will recommend that they cap for even longer after the chemotherapy, but there isn't great data to support that. For machine caps, though, I do tell patients that you can extend your pre-cooling time to 45 minutes and your post-cooling time to 2 hours to allow for better results if your center will allow that. Make sure that the cap is very tight to the head. Sometimes for the machine caps, the cap can pucker a little bit, so just make sure that it's really tight. The capping technique is so important. Also, if you have both taxanes and anthracycline chemotherapies, talk to your oncologist to see if you can get the taxane drugs before the anthracyclines. There is some data that shows that this can improve the results of scalp cooling. Machine caps are typically easier to use than manual caps because you don't have to change the cap every 25 minutes. You don't need a capper to come to the session with you. So some patients will just choose to use machine caps for that reason. To learn more about scalp cooling, please read the handout that we have put in your chemotherapy packet. You can look at websites like rapunzelproject.org, capandconquer.org, and speak with your family, nurse navigator, and social worker. If you make the decision to use it, the next steps are as follows. 1, if you're using a manual cap, please reach out to the cap companies on the handout to find the one that works the best for you. If you are doing machine scalp cooling, please reach out to your nurse navigator or your social worker to learn about the next steps. Remember, this is all time sensitive and you want to do it as far in advance as you possibly can, and it must be started before your first chemotherapy treatment. We at Henry Ford Health are so glad that you've taken the time to watch these videos and learn about scalp cooling. We know that this might feel like a lot of information, and we want you to know that we are here to help you every step of the way. Please do not hesitate to reach out to your nurse navigator, social worker, or cancer doctor to learn more about scalp cooling.